Okay, so evaluating a blood smear under the microscope, you could be asked to do a platelet estimate, a differential white blood cell count. So when I start, you want to start on the 10x objective, and you will want to start looking at the feathered edge, especially if you're doing a platelet estimate. That's where platelets are going to clump, and you just want to make sure you do or you don't have that happening on the slide, because that will definitely affect your count. So that's where I start initially, even when I'm also doing a differential count as well. And if that looks good, then I will find a good area to do my platelet counting, my differential white blood cell count, which is an area where all the red cells are dispersed as evenly as you can find. And then I will drop down to the 40x objective, another objective that you do not require oil. And unfortunately, this objective has a lot of oil on it, and it shouldn't, and so I'm going to clean this objective. So this, you may run into this in your practice. It's not the healthiest thing for an objective to have oil on it unless it's a 50 or 100 objective, which is designed for that. So you just want to take your lens paper and your lens cleaner, and I just apply it onto the lens paper like so. Just a few drops, really. And then I will just gently clean off the objective, the bottom of the objective. You don't need to take it off or anything like that. And then I go back, take a look again, and it is looking much better. And as you go to the higher objectives, you want to adjust your light as well. And so this would be the ideal area ideal objective and area on the slide where you want to do your differential white blood cell count. And so I know on this particular slide, this patient does not have a very high white cell count. So this differential could take you a while, but this is kind of what you want to look for when you're doing that count. And at the same time, when you do these counts, you want to evaluate morphology on the white cells and the red cells. And when you go to do a platelet estimate, you use the 40 objective to find that good area where everything is distributed. And then you can go down to your 100 objective, which will require immersion oil. And all you need is 1 drop of immersion oil. A little bit goes a long ways. You never want to use too much. Spills over the side of the slide, gets into the sensitive areas of the microscope. And when you go to the 100 objective, you'll need to turn the light up, and then you need to refocus. And so this is the great area where I would start to do a platelet estimate. And then also this is even a better opportunity to evaluate red cell morphology too. You can just see it so much better, along with white cells as well. And you just scan. You just stay within this nice area where everything's evenly distributed. You don't want to go too far into it where you have cells like this, which are stacked on top of each other. So you want to stay in that area where it's not too crowded and it's not too thinly dispersed as well. And take your time and just evaluate as much of that slide as you can, and you have time to do, and just take notes on everything that you see. And then when you're done, it's really important to go back, take a clean piece of lens paper, and you always want to wipe off the objective that you applied oil to, because that can cause damage, and their objectives are very sensitive. They're also very expensive. And that's how you approach looking at a slide under a microscope.